It's a pleasure to be talking to you all this morning. Acupuncture is obviously a different type of medicine than what we're used to here in the United States. But I'm happy to say that the longer it's been here, and it's been in the United States more prevalently since the 70s, but that maturation to today has grown to see it begin to merge and integrate into a Western model, and to where we can have a compatible relationship, especially with mental health. I think that there's a strong relationship there that can be created and fostered to help the patients. The patients are number one for all of us. Today, what I want to talk about, and I'll give you a little bit about my background, but today what I want to talk about is emotional balance and just the acupuncture and Chinese medicine perspective on how to approach these types of conditions and how we do that. And I'm going to get to, towards the end, I'm going to get to sort of how my thought process and how an acupuncturist's thought process is, and how diagnosing someone and treating someone, and getting through and getting them to the other side. I started out as a hospital corpsman in the Navy, so I was a medic, and I was a medic for Marines. And so I was trained in Fleet Hospital, where as a medic, spent a lot of time with Marines who had gone to overseas or gone to a conflict and come back. And these people would take a bullet for you. I mean, they would do anything for you. They would walk that line for you, but they were really afraid of shots. They didn't like the blood drawn or anything like that. So, but they do okay with acupuncture needles, which I'm happy to say. But it was kind of a funny running joke with us Navy medics that the Marines were so tough, but not so tough. But with acupuncture, I've been doing acupuncture for about 11 years, and here in Tallahassee. Practice is growing, and when I started practice, we had about 9 or 10 or 11 acupuncturists in town. Now we're up to about 24. And I'm happy to say that it is a growing profession, and more people are starting to use it, use acupuncture services. Well, acupuncture is a holistic medicine. Everybody's heard that term, integrative medicine, mind, body, spirit medicine. That's what acupuncture is. We can't avoid treating one aspect of the person without treating the other. Okay? So if someone comes in for a physical ailment, or a mental emotional ailment, or trauma, or rehab from a surgery, acupuncture is looking at all aspects of this person. And our intake form is rather extensive. I spend an hour and a half with each first-time patient, and that includes their first treatment. And going through every aspect of their health. And a lot of times, and maybe you all have seen this too, is someone will come into the clinic for a certain condition. My shoulder hurts or my back hurts, but there's really more things going on with that patient. And so with acupuncture, the Shin, or the spirit, is what we work with. And when we're talking about mind, body, and spirit, we're talking about mind and the mental capacity and the ability to work through things, the body with physical ailments, and then the spiritual aspect. We work with them as well. So what I like to do is begin by doing a little exercise. And in my practice, I do acupuncture and Chinese medicine, but I also incorporated something that maybe you all have heard of called heart math. Has anyone heard of it?
What's it called?
Heart math.
Top one.
Top left. Heart math is born out of the Heart Math Institute, and they're out of California. They've been studying the heart for about 25 years. And Heart Math, the Institute, has studied the functions of the heart. They've also studied how emotions affect heart rhythm and how that affects the rest of the body. The ultimate goal with Heart Math is to achieve coherence. And when Western medicine says coherence and Western science says coherence, Eastern medicine says harmony. So what we're trying to do is harmonize the heart with the brain. With Heart Math, we have several different techniques, and they're essentially like biofeedback techniques. In clinic, we attach a sensor similar to electrodes or an EKG to the earlobe, and it sends a signal to our computer and gives direct feedback as to how their breath is in tune with their heart rate. What Heart Math has found is that when the heart is out of rhythm, if we're in anger, if we're in irritability or sadness, the heart shows a certain rhythm, and that rhythm is usually out of alignment with the rest of the body. But when you get into coherence, that heart rhythm actually develops a nice, beautiful sine wave. And a lot of our Fitbits nowadays are measuring heart rate variability. This is kind of a nice trendy term that's coming into play now, mostly due to HeartMath's research. Heart rate variability measures the harmony or the balance, the coordination, the coherence between the breath and the heart rhythm. So this first technique we're going to do today is called the quick coherence technique. And really simple, which is why I love it, why I brought it in. It's a nice add-on to whatever treatments you're doing. This typical technique is done in about 2 to 5 minutes. And I recommend for people in practice to start out the day 5 minutes doing HeartMath, and then finish the day doing HeartMath. And then whenever is appropriate for your lifestyle.